Good evening, everyone. Good evening and welcome to the masterclass of therapeutics. And I'm so happy to see all of you here. So let's start. So myself, Dr. Yamini Ramesh from Asha Homeopathic Academy, and I welcome you on behalf of the team of Academy and welcome to this masterclass of therapeutics. So today we have with us some of our speakers of therapeutics course. As you know that this masterclass is organized to give you more information about the course, and along with that also I will teach you some diseases and some remedies which are very commonly prescribed for those diseases. So we will be discussing a lot of therapeutic remedies and how we decide the remedy, what should be the potency and what should be the repetition and all those things. But before starting the presentation, I would like to invite our senior speaker who is going to take 2 sessions in this therapeutic course, Dr. Jyoti Udupi. Dr. Jyoti is a senior homeopath and she has more than 20 years of experience and she is an amazing homeopath. I have learned a lot of things from her and I'm really looking forward to talk to her today also and in her sessions. So Dr. Jyoti, most welcome. So happy to see you here.
Yeah, good evening. I'm also so excited. No, whenever Dr. Yamini comes, she brings a lot of energy to all of us.
Thank you. And same to you. So happy to see you.
Yes, yes. Before, can you allow me to share the screen for just 2 minutes?
Yes, you can share now.
Yeah, thanks.
So guys, I have a request to all of you. Please kindly keep yourself mute so that there won't be any disturbance in between. And let's listen to this amazing homeopath.
Yeah, many of you must be, wondering why we need therapeutics. Because nowadays you have a lot of schools and a lot of new things are taught. But somewhere we all feel the basics are missed by many budding homeopaths. So in 1939, there was a doctor called W.A. Dave. He has written one wonderful book on therapeutics. These things I am going to repeat from his preface from his books. He writes, believing that the best and safest diagnosis is the pathogenesis leading most directly to the homeopathic remedy. Why therapeutic important? In that first, the point he says is, if you know the diagnosis, it is very, very easy to find out homeopathic remedy. This is unchangeable by ever-changing lab findings, by fashion or fads, by the various theories of disease, by the presence of this or that germ, toxin, or morbific process, or by this or that germ, toxin or morbific process, or by this or change which may come about in the nomenclature of disease. A sick person carries signs in his approach to his illness, and each individual is the processor of a totality of psychic reactions, physical and biological reactions that belong to him alone and constitutes his treatment. Homeopathy individualizes, and its application should be first specific to the individual, and second, by individualizing the remedy, we best define the morbid process and remove them. The sooner we of the homeopathic school get back to the fundamentals of homeopathy from which some of us have wandered, the better of us and our patients. You see, after studying, I understand headache is upon psoric basis, whereas diarrhea is a psychotic. Homeopathic physicians, with their intimate knowledge of the action of drugs on the healthy human body, will readily recognize as none other can. Thus, we are able to distinguish and classify them and be the better able to combat them and leave a cleaner soil for the action of the indicated remedies. Yeah. So I know it is very difficult to understand that old literature, no? You have to go through 2-3 times, then only you will understand. But recent advancement in homeopathy is PM method, personal evolution method. In that also, when you read, no, in better understanding, you have so many columns. Each column you see their sphere of action is on different organs. So it is very, very important. If you know therapeutics, it is very easy to practice, especially for beginners. No, I remember when I was in 4th year, we had a medicine lecturer. He used to give each day one topic where we have to write from Boric. If you know Boric book, go to the last pages. There you have an index where if you see like urticaria, you have 100 remedies. The homework for us was read each remedy and write down what all symptoms are, urtica symptom is there in that remedy. So that helped us in our practice later. So whatever way you practice, but if you don't know therapeutics, if you don't know disease and the homeopathic remedies, I think it is difficult to practice. So this course, I am really excited. Not only learning, teaching you, but also I am going to learn a lot of new things. And, we all together learn. Thank you, Dr. Yamini.
Thank you, ma'am. Thank you so much, and it's always pleasure to listen to you. And you rightly said that if we don't know the remedies for diseases, I mean, yes, we have to individualize, and every remedy can act in any disease depending on symptoms. But if we know the sphere of action, that builds a lot of confidence, and especially for beginners, because if you don't get that confidence that yes, I can prescribe for any disease, then a lot of chaos happens, especially in the beginning. So
and one more thing, what I have noticed is there are two things, no? Curable things and incurable things. So even if you want to palliate, if you don't know therapeutics, I think it is difficult. Yes. So whatever, and everybody has two types of practice, chronic, acute. If you want to treat acute cases, then if you know disease wise, it is, I think, wonderful. You can help patient better.
Yes. Even I was reading yesterday for this, I was preparing the presentation. So I was reading some Google literature on therapeutics, and it was some allopathic book. So there also it was written that, the therapeutics has indications and contraindications. So some people think that, therapeutics means the disease and you prescribe the remedy. That is not true. Even in allopathy, there are indications, and on basis of those indications, they would try the therapy. If it works, it's good. Even if it doesn't cure, it will at least palliate, and there are certain principles on which it is prescribed.
Actually, it is for all of us wake up call. If you ask people what medicine you give for something, they say in homeopathy from A to Z you can give any medicine. I somewhere know, personally I don't believe. There are set of medicines especially suited for certain diseases, because patient, when they say symptom, along with the homeopathic individualization, we also see what they are suffering from. No, you cannot deny the fact that they have some, you have to do diagnostic thing also. So not all remedies are for all diseases. This is my personal view. So in that connection, therapeutics, I think, is a wonderful learning. So thank you, Dr. Yamini, for starting this course.
Thank you. Thank you so much for accepting this invitation. And we are really looking forward for your session. So guys, Dr. Jyoti ma'am will be taking 2 sessions, and you'll get the details in the end. I will tell you when and what would be that sessions. But in short, I want to tell you that this course will happen on Fridays and Saturdays from 7 to 9 p.m. And obviously you will get the recordings. A lot of people were asking that whether they will get recordings or not. So we will provide you recordings for next 6 months. So course is for 3 months, but you will get recordings for next 6 months from the starting of the course, and you can watch the recording again and again. Second thing, that we will dedicate 2 days for one topic. So suppose Friday and Saturday we are taking, okay, so there will be 2 or 3 speakers. In some modules we have 3 speakers as well. So all of them will be, sharing their experiences, cases, investigation part, diagnostic part, in the module. And we will share a lot of remedies which are very well-known remedies, or even lesser-known remedies, but very good for that specific disease. For example, we have a module on a headache and vertigo. So we will be sharing a lot of migraine remedies. We will be sharing a lot of vertigo remedies. Similarly, we have a module on GI disorders. So we will discuss a lot of GI problems, GERD, acidity, and IBS, IBD. Recently I have treated a lot of IBD cases, so I'm really looking forward to share those cases. So you will learn remedies and the clinical management part, because see, clinical management of any diseases is extremely crucial and very important. If you just treat it, just give the remedy and forget the patient, that doesn't work. Frankly, you have to tell the pros and cons of treatment, lifestyle modification, diet and regimen, and a lot of such things. Also the investigation part. Sometimes I have seen that, as a homeopath, I have also done this mistake, that I have neglected this diagnostic part in early days of my practice. So we don't want you to do this mistake. That's why we have invited very senior clinicians who are really good in what they are doing, and they will be sharing their experiences. In the distillation process, how it happens, it's like everything is distilled and you get the pure thing at the end. So similarly, in therapeutics course, you will get to learn a lot of things. So thank you so much, Dr. Jyoti, for joining. And
it's pleasure. Yeah,
thank
you.
Thank you. So let's start. So I'll be sharing some of the diseases today, some of the pathologies. Especially, I wanted to cover cough, because cough is such a general thing, and if we learn, I always believe that if we learn to treat cough, cold, and fever for first 3 to 4 years of practice, it becomes your bread and butter for life. You just win the heart of a patient by treating cold and cough. Okay, I hope I'm audible. Someone is saying I'm not audible. Can you tell me?
No, you are very much audible, very clear.
Audible? So Dr. RP, please check your earphones. There must be something in the earphone. Yeah, okay, thank you. So let's start. So I would share some of cases and some of the remedies, so that you get a good idea about how we are going to teach you, what we are going to discuss, and all other things. Okay. So welcome everyone to this masterclass of therapeutics, and welcome all of you who are watching on YouTube and Facebook. We are doing live. Okay. So what is therapeutics basically? First, we need to, I want to break some myths, because a lot of people think that therapeutics means not classical homeopathy. Therapeutics means, it's not a good type of homeopathy. This kind of myth, or this kind of, obstacle we have in our minds. So I don't think that is true. And why I think, I'll tell you, because earlier I also had such type of thought that, oh, it is not classical homeopathy, but it is, because when you read Hahnemann's Materia Medica or chronic diseases or lesser writings of our classic teachers, stalwarts, you will understand that they have treated all the diseases, not one, two, three, I'm telling you, all the diseases on the basis of therapeutics. And therapeutics doesn't mean you take one symptom and prescribe. No, not like that. But they would understand the symptom and disease and the disease process. Like, like Dr. Jyoti said that wrote that you have to understand the pathogenesis, how the disease developed. And then, they have treated diseases with different remedies, like with a chain of remedies, not one, two, three remedies. Sometimes, it gets cured by one remedy, two remedies. Sometimes it requires more than that. But that is also selected homeopathically. So what is homeopathic selection? On the basis of similarity. That means it is truly classical practice. It has nothing wrong, to do anything like therapeutics. And if you do it correctly, I can assure you, your success rate will increase like anything. This is purely practical and nothing theory. You just observe well, become a keen observer, understand the disease process, and prescribe and see the result very, very quickly. There are times when you get a whole case and a lot of mental symptoms and dreams and all those things, and then you prescribe. That is also therapeutics, because what happens if you are getting, suppose, mental picture, okay, and if some remedy has that picture, that means that remedy has purification on mind. So that also becomes therapeutics. So this is a definition of therapeutics per se. So treating a symptom or disease based on diagnosis, that means disease, to alleviate the suffering, and each therapy will have indications and contraindications. So obviously, where it will work and where it won't work, we will talk about that for sure. But in most of the cases, it works. And in most of the times, you will need this to gain confidence of patient, to cure him faster, to produce results and to replicate results. And especially if you want to gain confidence, it's a great way to understand Materia Medica. And then once you learn therapeutics, you can actually learn other facets of the same remedy. All other facets, general, mind, dreams, and lifescape and all those things. But first and foremost, important, therapeutics. So let's start. I will show you some of the cases. So this is case one. This female came to me. She was pregnant when she came to me. It was, I guess, 2 years back. 2 or 3 years back, this case came to me. Pregnancy of 9 months, due date in 15 days. And she had very bad cough, extremely bad cough, lot of weakness. She said, I'm coughing from last 3 days, 3-4 days. And she went to a gynecologist because her due date was coming. So she was very much worried about the kid, that if I cough so much, it might affect my pregnancy and delivery both. So she has not runny nose. She went to her gynecologist, and gynecologist said, okay, antibiotics le lo, you'll be fine. And she prescribed antibiotics for 5 days. And she said, if anything happens, just let me know. But when she came to me, it was already 3 days. Okay. So she said, I'm taking it from 3 days, but I don't have any relief. So in cough, she did not have relief. She didn't have fever. She had a little bit of weakness, which was little better, say, 5-10% better with the antibiotics, but rest, it was okay. She said, I can't sleep, doctor. I couldn't sleep yesterday. For whole night, I was awake, because as soon as I would, sleep, the cough will come. The cough was too much in night, then vomiting happened, and the yellowish expectoration came out. And after that, she was little bit better, but very little. She said, I'm very nervous, doctor, that, I'm coughing very badly. Something will happen. Mere bachche ko kuch ho jayega. And then she said, nothing else is happening, only weakness, cough, and I'm not very badly. Okay, so this was a case. So this is what I did. I went to the repertory, I tried repertorization, and she was a very mild kind of woman, very, yielding disposition, and she was crying also because she was worried and all those things. But I took all confirmed symptoms, or where you can anchor your case. So I took lying aggravation, CORYZA with cough because she has runny nose also, cough in catarrh, weakness during cough, cough exhausting, vomiting during cough, cough in night because night was the most horrible time for her, cough during talking because talking aggravates, woofing convulsive cough. So can you see there are 2 3 remedies which are covering most of the symptoms. Okay, Nux vomica, carbohydrate, pulsatilla. So based on her nature, I thought it is pulsatilla. I prescribed her pulsatilla. Okay, so because she was very mild natured woman with little chilliness also. So she was, she was feeling chilly because we were sitting in, in an AC. So she said, can you stop please? And night aggravation. So I thought, okay, I was very sure of pulsatilla. I gave pulsatilla 4 doses next day because we didn't have much time. So I said, Kali batao mujhe, how did you, how would you feel? So next day she came and she said, she was very weak, I'm telling you, very weak. I could see her and I thought, abhi kya ho gaya? She was very weak, little bit of relief was there. And she said, doctor, main pareshan ho gayi. This is, in Hindi she said, main pareshan ho gayi, it's bothering me a lot. Then I thought, no, you have to again see what is coming. So I again went to the repertory. I took only few things and I just took one more rubric, that was cough tormenting. So lying aggravation, talking aggravation, cough during vomiting, exhausting cough, and tormenting. Because what she said, main pareshan ho gayi. It was bothersome for her. And the remedy came was Drosera. But if you look at previous graph, can you see Drosera is a 4th remedy? Drosera was there, but I did not paid attention to that remedy, frankly. Then I gave Drosera 1 m. Okay, and why? Look at Allen's keynote. So whooping cough is violent paroxysms which follow each other rapidly, scarcely able to get breathe, coughing until a large quantity of tenacious mucus is raised. So what happens in Drosera? They are not able to, raise the mucus. That's why the vomiting happens. But vomiting gives very little relief, and again this cough comes. This happens all night. So this is a known remedy for nightly cough with lying down aggravation. I just gave Drosera 1 m TDS because I didn't have much time. And she was totally tormented. And see what Dr. Shankaran has written in his book. The Drosera cough too is described as harassing by fatigue and accompanied by irritation and violent paroxysms. So what she said, "Main pareshan ho gayi." And after this, this Drosera 1 m, see choking, prolonged, incessant cough. Next day, the very next day, that means on 2nd day of giving this remedy, weakness was reduced by 60%. Sleep was better, cough is much, much better. Almost, half of the cough was gone, more than half even. And she was much better. Then same day, I prescribed her CBC. So what happened, due to this weakness, I said, chalo check karte, it's, 9 months pregnancy. We saw that the platelet was 1.7 lakh. Can you imagine? It was either dengue or something. Her platelet was very low. So that's why she was very, very weak. So, but I did not change the remedy because it was indicated with Drosera 1 m and some dietary changes. After 3 days, platelet became 2.8 lakh. And after 3 days, this happened. She was totally okay, all normal, no cough, nothing at all. And 5th day of the treatment, after starting this, she delivered normally. So she was all good. And thankfully, her platelet also increased because of, Drosera and dietary changes as well. So this was a beautiful case for me because, we could help such emergency condition because pregnancy is another complication for such type of cough. So in this case, what I learned that whenever you're handling an acute case, you have to act very fast. You have to change the remedy if it is required, if it is indicated. Whenever someone asks that when to change the remedy, So the answer is whenever indications change, change the remedy. So change in indication is the indication to change the remedy. Always remember this. So in this case, it was not change in indication. It was actually I couldn't understand the remedy in the first time. It was Drosera, but I couldn't understand. But this was also my learning that even if you prescribe close remedy or wrong remedy, I would say, it would also lead you to the right one. Okay, so that was the learning. So Dr. Shraddha is asking, can we prescribe Tinospora mother tincture to increase platelets? Yes, you can. So what HAHNEMANN has written in 171 aphorism, see, whenever we prescribe 2 remedies, 3 remedies, or sometimes, change the remedy, we just, take the guilt trip, right? That, oh, change kar diya. So this is what HAHNEMANN said, and this is for all of you. He says in 171 aphorism, in non-venereal chronic disease, those therefore that arise from sora, we often require, in order to effect a cure, to give several antisoric remedies in succession, every successive one being homeopathically chosen in consonance with the group of symptoms remaining after completion of the action of the previous remedy. So what he is saying, that you might need several antisoric remedies in succession to, in order to cure the disease. But that should be, what is the one condition? That this remedy should be homeopathically chosen with the group of symptoms remaining after completion of action of previous remedy. So just let the first remedy act, and if you think that there is a change in indication, you can change the remedy. And who is saying this? HAHNEMANN. So we have to listen to him, right? Now let's talk about second case. So this was a case of food poisoning. This was a 6 years old baby. She came to me with a lot of pain near umbilicus, and it was a very bad sort of pain. She was almost crying, making very bad face. And the father told me that, she has taken this kachi haldi ka doodh, raw turmeric milk. So the parents actually put the raw turmeric into the milk and they gave it to her, because that time, it was a corona time. So a lot of people were, actually doing a lot of home remedies, and they were falling ill and such things were happening. So they came to me, and she had bad vomiting, bad cough, and a lot of sleepiness. And when they came to me, it was almost 7 p.m. or something, 7:30. So the father said, today 2 p.m. the last vomiting happened. She did not have tonsillitis. One thing I observed about her is she was a very friendly child. She was talking to me. She came to me very, in a very friendly way. She spoke well, and she was like, "Doctor, बहुत दर्द हो रहा है. Please do something." She was very talkative. Chest was clear, no rattling. So it was not a, though vomiting was there, it was not a case of cough. She had a lot of, little bit of cough, but it was mainly the stomach was affected. Father said her immunity is weak. She falls sick many times, and vomiting is very common. She eats well generally, and she loves ice creams and cold drinks. And she's a little sleepy also because of weakness. So obviously, after taking all these symptoms into repertory, see, abdomen pain after eating, pain in umbilical region, vomiting during cough, because she had a little bit of cough, sleepiness, cough in children. This is a beautiful rubric, cough in children. Stomach vomiting in children. This is also a specific rubric for children, and ice cream desires. And this takes you to varidrum, phosphorus, sulfur, pulsatile. Okay, which is covering everything. So obviously, ice cream desires, talkative, friendliness leads you to phosphorus. I give phosphorus 200 3 times a day. And see, what was the date here? This was 22nd Jan. Okay. And this is 24th Jan. So on second day, because she started medicine on 23rd. Okay. She came to me the evening of 21st. No vomiting after second dose. But she was still weak. So I just told them to, stay hydrated and just give her some electrolytes, because a lot of vomiting happened. So she got better in, with second dose itself. So in this way, you can cures also in a very fast way. If you understand the pathogenesis, phosphorus is a very well known remedy for all gastrointestinal problems, and especially for food poisoning. I'm telling you, if vomiting is not stopping, and if you get cold desires for, yeah, cold drink desire for, or ice cream desire for, with some of, friendliness and communication skills, then you can definitely prescribe phosphorus. You just have to take 2 3 things. Next case. So this was a complicated case. I just had a follow of this case today. So this is a 35 years old female. She is a known case of hypertension and hypothyroidism, and sugar was also borderline. She's quite bulky, and her symptoms were, she said, whenever I walk, I just get these palpitations. My heart just, beats very fast. And doctor, I'm really worried about health. She was a very worried female. She said, something will happen to me. I always think, at 32 years of age, I got this hypertension. Doctor started this antihypertensives, and see, now something will happen to my heart. I will die, and all those things. And she was also worried about work. So there was a lot of work going on in her office. She's a computer engineer. So she said, I'm really worried about work. I'm really worried about my health. And I can't walk for very long time. As soon as I start walking, the palpitations will happen. TSH was 11.9. Okay. So this was a case. That's all, nothing else. I prescribed calcarea. Why? I'll tell you. Because calcarea, like symptoms, this palpitations while walking, palpitations with any kind of exertion, slight exertion aggravates. That's the symptom of calcarea ars. And this anxiety part tells you about arsenicum. Okay. So I wanted a 4th row remedy. So I prescribed calcarea ars. And this is also a very good remedy for heart conditions, any kind of heart conditions. After 1 month, she came to me. So this is not an acute case. Okay. This is a chronic case. She was much better, no palpitations. But she told me one more thing. She said, I'm getting irritated. I'm really irritated. And periods were delayed. So she had amenorrhea. Sweating was profuse on head. So again, it indicates calcarea carb, isn't it? Calcarea-like remedy. But what happened is the TSH did not go, down. It was still 8.5. From 11, it went down, but still it was not normal. So what I did, I gave, in such cases, when you see that the hormonal dysfunction is there, and this irritation and sweating, obviously it indicates calcarea carb, but you have to understand that this is because of, hypothyroidism. This is not a symptom of a patient. This is symptom of hormonal dysfunction. So we need a local remedy, or we need an organ specific remedy, which just stimulates the endocrine glands. So that's why I gave calcarea carb in low potency and not in high potency. Calcarea ars I gave in 200. Okay. So I give calcarea carb 3x, 1 tablets 3 times a day for 15 days. TDS, Sida. Because I wanted this TSH to go down, and I knew that if TSH is normal, the irritation, sweating, everything will be okay. Periods will also come. So TSH became just in 20 days, 2.2. Everything is good, no complaints. Weight also decreased by 2 kg. Imagine, and she did not do anything special for, losing the weight. She was on normal diet. She was exercising earlier also, but she couldn't lose because this metabolism was so slow. So she lost 2 kgs, TSH became normal, no complaints, no sweating, no palpitations, no anxiety, no work-related stress. And this, this was possible because of addition of calcarea carb. But her overall, I would say the constitutional remedy was still calcarea ars. But she needed, to be treated for the state which has appeared because of hormone dysfunction. So you have to understand the state and treat accordingly. So in this case, I treated with another remedy which just supplants, or supplements or push the cure a little further. So sometimes you need physiological remedy or local remedy, it's required to further the healing. So this was a learning in this case. So this is about cases. So I wanted to show you different cases, from different backgrounds of, one of hormone dysfunction, one of cough, one of, food poisoning. Now let's talk about therapeutics of cough. This is one of my, favorite topic, also because this is, like I said, this is a bread and butter for most of us, and you'll get a lot of cough cases in day-to-day clinic. So, let's start this, and I'm really hopeful that you will learn something new today. So what is cough? Basically, it is a voluntary or involuntary act which clears the throat and breathing passage of foreign particles. And coughing can be done deliberately or as a part of reflex. What are the causes of cough? There will be short-term cough or long-term cough. That means acute and chronic cough. So if you look at acute cough, most of the cases is because of URTI. What is URTI? Upper respiratory tract infection. So it can be because of, the cause is pharyngitis, sinusitis, reflux, cough, and some unknown causes are also there. Now, lower respiratory tract infections. They are also extremely common. And as a homeopath, you will get lot of cough cases with both categories, URTI, LRTI. So bronchitis, pneumonia, asthma, COPD, and allergies. Acute cough can be also because of allergic condition, allergic rhinitis, some, pollens or anything, any kind of allergy. And allergy can also be also because of intrinsic factor or extrinsic factor. Extrinsic means where you can actually get the allergy test done and you can see what is causing allergy. Intrinsic means you do not know what is causing allergy. It is kind of autoimmune thing. And most of such cases are beautifully treated by homeopathy because you can just raise the immunity and decrease the allergy very easily. Okay. So let's talk about chronic or long-term cough, which remains for more than 8 weeks. So chronic cough may be caused by smoking. Sorry. And this cough is not because of smoking or any such thing. It is because of talking continuously. So while you talk about cough should come so that it becomes, a symptom. So it could be because of smoking, because of post-nasal dripping, mucus dripping down the throat from back of the nose. That is called as post-nasal dripping. GERD, gastroesophageal reflux disease. So this is, here I want to tell you that GERD is, it causes, in 30% of cases, you will see GERD as the cause, but we forget GERD somehow because we always, see at the respiratory elements and we do not investigate the gastric problems. So if you don't take the case well, you won't understand that the cough could be because of acidity. So that is why the investigation part is very important. Diagnosis is very important because if you get the diagnosis done rightly, then you can understand the prognosis of the disease, that how it will be treated, what would be outcome of this disease, and whether it is incurable, curable, or in which category basically. So that's why GERD is also important cause of cough. Then asthma, some medications, if someone is on ACE inhibitors or some other medications which can cause cough, that is a problem. Tuberculosis, lung cancer, fibrosis, COPD, chronic obstructive pulmonary disease, fungal or viral infection in lungs, post-viral cough, or cardiac cough. It could be because of cardiac problems as well. Chronic coughs in children are most often caused by asthma, but can also be from conditions like post-nasal drip or GERD. In children also, I have seen we forget GERD because we think, he's a child. No, it's not true. He can also have GERD. Okay. So why I'm talking about this? Because as homeopath, I have seen you will get forever in your life, you will get cases of allergic rhinitis because it doesn't have any cure in allopathy. Chronic cough for sure, dry or wet, whatever. Sinusitis for sure because it's a long-lasting kind of thing. Asthma, COPD, tonsillitis, and reflux cough. These are very common conditions which comes to a homeopath's desk. So we have to get ready to be able to treat it. So what you need to look into the case of cough. So these are some things which should be there whenever you are examining a case of cough. So look for onset. How did it start? Was it slow? Was it fast? Okay. Duration, for how long the cough is there. Character of cough. Triggers of cough. What causes cough? Talking, lying down, sitting, smoking, or changing the room, or changing temperature, or anything like that. Color of cough, consistency of cough, time of expectoration, whether it is morning, night, daytime, in what form. Then modalities, aggravation and amelioration, volume. Okay, what is the volume of the cough? Smell of cough, or smell of the, the breathing, duration and character. These are most important things. If you get this, I'm telling you, you don't need anything. You can prescribe easily on the basis of cough. And second thing, which is again very important, is sound of cough. You have to hear the cough. I always say you have to hear the cough, otherwise you won't be able to treat it. So the most important part is examination, which we miss most of the times. Don't miss it. Always inspect throat, mouth, chest and back, auscultate lung sounds and heart sounds, and examine the sputum and saliva if it is required. What are the common investigations? Routine blood examination, eosinophilic count, because it will tell you whether there is allergy present in the body or not. Sputum culture, if you suspect tuberculosis, gram staining. Chest x-ray is needed. Pulmonary function test you can prescribe. Paranasal air sinuses for sinusitis. Allergy test. CT, MRI, bronchoscopy, ECG, echo, endoscopy, or biopsy, whatever is needed. So these are very common investigations. I'm telling you, even CT is very common. You can prescribe it easily if you suspect COPD or lung cancer or any such thing. So homeopathically, how would we manage cough? So you have to do, first of all, obviously, proper case taking is required. Ask about origin, duration, character, causes, modalities, type of cough, expectoration, and sound. And please, this is my humble request to everyone, hear the cough and prescribe. Differentiate based on sound and peculiarity. In every materia medica, you will see that there will be, definite sound will be mentioned, whether it is rattling or hissing or wheezing or whistling, or gurgling. In cupromet it is written gurgling sound of the cough in the chest. So if you hear the cough and you understand what kind of cough it is, you can easily prescribe the remedy. So for rattling cough, we have Antimars and Antimtart. Antimtart is very known, but I have used Antimars extensively for rattling cough. Then we have Theridion or in spider, which is for jerking cough, right? Then machine gun cough. How is the machine fires, one after another. So Corallium rubrum has machine gun cough. And it's not typical machine gun sort of, but it is like the paroxysms follow each other very, very rapidly. That is called as machine gun cough. Let's read it. See, it's from Boric. Throat very sensitive to air. Profuse secretion of mucus dropping through posterior nares, dry, spasmodic, suffocative cough, very rapid. They won't be able to breathe, short, barking cough. So that sort of cough is there in Corallium rubrum. See, post-nasal catarrh, odors of smoke, onion, and mucus dropping through posterior nares. Then you might have seen such people who would, just constantly clear the throat, constant clearing of throat. There is always this tickling happens in rheumats. Okay, so rheumats has this constant clearing of throat, and he would always cover the head with bed cover. So they will tell you, Doctor, pura od ke sota hu. I can't sleep without having a covering. Okay, and there's this constant tickling which they want to clear because in Hindi, it is called as kharash. There is something in the throat. This is rheumix. Then coryza and cough with chilliness. If someone is very chilly, and along with that, have sweating, then the remedy is sambucus. But if he's very chilly and cannot put the hand outside the bed cover, then it is hippersal. So hipper and sambucus, both are very chilly remedies, but sambucus is mostly, I'm telling you, I have cured a lot of infants with sambucus. It is majorly a remedy of infants, of children, when you will see a lot of sweating with cough. And hipper we already know, choking cough and weakness, much rattling, but larynx very sensitive to cold air, loss of voice. If it is dry cough and aggravated at night, and in morning expectoration happens, then which is the remedy? Spongia. Then one remedy comes very close to spongia, that is Drosera. Okay, but in Drosera, it is total dryness, and in the whole night they would just cough, and they can't sleep, they can't touch the pillow. And it is majorly for whooping cough. Okay, spongia is mainly for glandular affections. So the sphere of action is little different, and sponge are breathing through the sponge. This is an Indian remedy, CASSIA sophora. Okay, so this is a very well-known remedy for asthma after cough. So what will happen? The cough and followed by dyspnea, or dyspnea after cough. So cough will happen and then dyspnea will happen. So if person comes and he says, doctor, little bit of cough comes, थोड़ा सा मेरे को खांसी होती है, तो मेरी सांस चलने लग जाती है. थोड़ा सा खांसी और सांस चलेगा. So there will be a little bit of cough, then shortness of breath or breathlessness, and cherry on the cake, if they like desire for if they like curd and pickle, if they have desire for curd or pickles, go for CASSIA sophora. And remember, it is an Indian remedy. Indian people always love pickles, isn't it? Isn't it a commonality amongst all the Indian cultures that we have special love for pickles? If you compare, someone from, Western world, they would like pickles because that is too much for them. But as an Indian, we would have some love for pickles and chutneys and, different type of sauces. So remember, in this way that CASSIA sophora will have love for pickles, love for curd, and dyspnea followed by cough. So it is a very good asthma remedy, and it's a Indian one. So diminished appetite, see, desire for curd and pickles, desire for eggs and sweet, warm food and drinks, aggravated by cold, aggravated by rest and pressure. Hawking cough, where there is constant hawking, just like rheumix, clearing. Okay, hawk. Sticta. So sticta is also known as lung wart. It's a remedy for coryza, bronchial catarrh, nervous and rheumatic disturbances. So if someone has joint pains, muscular pains, very nervous, comes with a, with a cold or cough, think about sticta. It's a very nervous remedy, and its name is, its common name is lung wart. So that is Sticta pulmonaris. This offers a set of symptoms like coryza, bronchial catarrh, and influenza, together with nervous and rheumatic disturbances. So nervous, rheumatic with coryza or catarrh. That means lungs are involved, muscles are involved, and joints are involved. And with nervousness, that means nervous system. Then this is also another beautiful remedy for cough, COCCUS CACTI. It's an insect. Whooping cough attacks ends in vomiting of tough mucus. Chronic bronchitis, complications, then also you should think about this remedy. So what is the peculiarity of this remedy? That in vomiting, it won't be little bit of vomiting. It's always, huge material will come out. quantity of albuminous, tenacious mucus, and very sticky. You can't wash it off. That is expectorated. It would be like balls of, balls of mucus. That is coccus cacti. If this is also another Indian remedy, Justitia adodota. So Justitia you have to prescribe for CORYZA with dry cough. A lot of people will come and tell you that I have sardi, but there's no expectoration. It's inside. It's very dry, and there's dryness in the throat, dry cough. There is sneezing, and also they are constipated mostly. Very good remedy for acute catarrhal conditions. Especially used, it should be used in the beginning, just like aconite, because aconite you can't prescribe after some time. It has to be used in beginning of any condition, because what happens with aconite is a very sudden and violent remedy. So if suddenness is gone, that means obviously it's not indicated anymore. Similarly, Justitia adodota, you have to use it in the beginning. Then what happens in Indian households, whenever we have sardi, whenever we have CORYZA, what our mothers do, they would just give us tulsi tea, isn't it? So tulsi has a great anti-catarrhal properties, anti-allergic properties, and that tulsi is proved in homeopathy, that is known as oxymum sanctum. Oxymum sanctum is not only a cough remedy, but it is also a very good fever remedy for children. You can use this remedy very often, in children who have cough or frequent cough or pneumonia with fever. Oxymum sanctum is very efficacious, and it has come from Ayurveda. Okay, it's an old, very known remedy for cough, cold, catarrh, any nose affections, and also for scorpion bites. In old times, they used to give oxymum sanctum for scorpion bites. So if you want to get successful, understand, this is the punchline which I want to tell you, that if you treat the acute symptom, you will win the heart of the patient. And if you do that, the patient will be forever yours. This is the master key. So you have to learn to treat acute. If you will fail in acute, patient might leave you in chronics as well, because they want fast treatment, fast relief, and nobody wants to suffer for very long. Of course, some patients are patient, patient in that way. So they're patient, they will remain with you. But most of them want to get treated faster, and especially in acute condition, because acute symptoms are violent in nature. So try to do that. And remember, even if you go wrong, like I told you in this pulsatilla case where I gave Drosera liter, even if you go wrong, do not stop trying. Just be ready to see from another point of view and give the right remedy. Sometimes wrong remedy also opens up the case. Okay, wrong means partially selected. Wrong doesn't mean you give anything. Okay, wrong means it should be at least, you will see something at least. So that will be partially selected remedy. Will open up your path. It will further your healing, and it will lead you to the right remedy. So have faith, have trust in you. Okay, so let's talk about some of the clinical tips. So these are some clinical tips which I want to tell you, because summers are going on, and because of this scorching heat, you will see a lot of people with nausea and vomiting, and dyspnea also, because of heat stroke, because of lack of water, dehydration, and because of some food items also, or due to this changing weather, they will have breathing issues. So if someone comes to you like this, you can prescribe, if other remedies are not indicated. If nothing seems indicated, straightforward, you can give arsenic album 6C every 15 minutes in very acute condition until patient feels better. And whenever patient feels better, just decrease the doses. Like from every 15 minutes, make it every 30 minutes, every 1 hour, or even less than that. This will help you a lot. In vomiting and dyspnea, there has to be vomiting and breathlessness together. Then arsenic album in low potency, 6C. Now GERD, this is also a very common thing which will come to you. So if someone comes with, reflux, acidity, regurgitation of food, some chest pain, painful swallowing, and you see that this is GERD. Think about these remedies. These are very common remedies. Phosphorus, arsenic, Iris versicolor. Iris versicolor is the underused remedy, I feel. Amazing remedy for GERD, almost specific. Robinia, this is homeopathic antacid. If you give Robinia, you will see quick relief to the acidity. It acts, more faster than Eno. Carbovec is also for flatulent and slow and weak people. Natrum phos is also amazing remedy, but you have to see the tongue. Tongue will have, golden coating or yellowish coating with acidity, with vomiting of, yellowish bile. So this was about GERD. Now I wanted to show you some of the remedies and one case maybe in how we treat hormonal diseases in women, because this is also one of our topic in the therapeutics course, where we are going to talk about PCOS, infertility, menorrhagia, metrorrhagia, and other conditions also. So this is also very important topic of today's world, and it's it will surely come to you. You will have to encounter PCOS cases. I always say this is a next epidemic. PCOS, every third girl will have PCOS these days. So you have to get ready to be able to treat them. So hormonal disorders, we are not talking about PCOS only, we are also talking about thyroid, we are also talking about diabetes and other things. So what are hormones? So hormones are our body's chemical messengers, and they are produced in the endocrine glands. And these powerful chemicals just travel around your bloodstream, and they would tell the tissues and organs that what they have to do. So they are chemical messengers of, your CEO, that is brain, and it will tell the organs tumko kya karna hai, what you need to do, right? So they are responsible to control many of your body's major processes, including metabolism and reproduction. That is the most important thing, metabolism and reproduction, major processes like this. So when you have hormonal imbalance, when somebody has hormonal imbalance, either there will be too much of hormone or too little of the hormone. And even there is tiny change, they might produce serious effects. So we have to treat it, with sincere efforts. And it's very common in female population, and it is causing a lot of problems. And half of the problems I'm telling you because of lifestyle changes. But we can't change the whole lifestyle. We can't change the sedentary work style, because that is what we are doing these days. So we have to change a little bit in our lifestyle and add, which helps to regulate the hormones. So what are the common presentations? Diabetes type 1 and 2, hypothyroidism, you will see underactive thyroid, hyperthyroidism, overactive thyroid, thyroiditis, Cushing syndrome, PCOS, early menopause. A lot of females at 35, 40 are getting menopause at the age of 40, because it has to happen on around 50s. But these days it is happening very early. Primary and secondary infertility, fibroids, endometriosis. You will get a lot of cases of endometriosis, adenomycosis. Okay, so once you understand the hormone physiology and diagnostic part, you will understand that there are specific remedies to cure these diseases, and they can be easily treated with homeopathy. Easily, I'm telling you. Okay, but you just have to understand the whole pathogenesis and then treat it, and be alert. If any change happens, you have to be you have to grasp that and give the right remedy at the right point. So let's discuss some common clinical presentations. Menorrhagia. So what is menorrhagia? Abnormally heavy or prolonged bleeding. Okay, this is how it happens. Heavy periods, and it is defined as a blood loss of more than 80 ml per cycle. It The causes are, it could be because of fibroids, polyps, thyroid disorders, PCOS, liver kidney disorders, blood clotting disorders, and what is the treatment? Obviously, supplementation. Menorrhagia is intermenstrual bleeding. What was happening in menorrhagia? It was prolonged bleeding or profuse bleeding. But in metrorrhagia, it is happening in between the periods. Okay, spotting between the periods, very common disorder. It can happen because of ovulation, implantation, menopause, birth control pills, endometriosis, PCOS, uterine fibroids, and STDs. You have to understand three things. You have to understand how is the flow, what is the duration, what is the pattern, what is the color. Okay, and then ask your patient to get treated, and also for some lifestyle changes if that is required. Then PCOS. Can you see this is called as beaded appearance in the ovaries? So in what happens in PCOS, there are pouches of it's bubble like thing, cysts. So these cysts will appear in the ovaries, and this will hamper the normal functioning of ovulation and other things. So what are the remedies for PCOS? There are many, many remedies, but some are really gems in treating PCOS. You can treat, 30-40% of your cases only with these remedies, I'm telling you. Even, I'm saying less. It could be even 50% of cases. So Apis mellifica, remedy for right-sided PCOD. I'm telling you, why right-sided? Because it affects right ovary. It's a right-sided remedy. So majorly right-sided with, with jealousy, with busy schedule, a female who's very quick in nature, quick in acting. That is Apis mellifica. Then iodum with glandular affections. Obviously, ovary is also a gland. Calibrome, who have family issues, some cystic acne. In PCOS, one major organ which gets affected is skin. So your skin gets a lot of acne and dark circles and patches and whatnot. So calibrome. Then sabina, very good for menorrhagia, metrorrhagia, both. Profuse bleeding. Bufo, another remedy, amazing remedy for hormonal dysfunction in women. We just forget this, with high sexuality. Colocin for pains, for metrorrhagia. Lacasis again for early menopause, even the right menopause with a lot of symptoms, right age menopause, but menopausal issues, climaxes issues. Plumbum met, similarly used for climaxes. The rustox we always give for only for joint pains, but no, this is also a very good remedy for for uterine troubles. Apocyinum can for dropsies anywhere. Then if you look at climateric complaints, what are the climateric complaints? Hot flushes, chills, night sweats, insomnia, weight gain, thinning of hair, mood disorders, and dry skin, mostly, right? So these are the few symptoms of menopause, which are common, which will definitely happen. So CPI is one of the remedies for climaxes. Lachesis, we have graphite is amazing remedy for climateric complaints. Manganum aceticum, this is also one of the remedies for cough. Amazing remedy for climateric complaints. Sorinum, Crotalus cascivella, and pulsatilla. Okay. Then one major complaint you will get from females is hirsutism or unwanted hair growth on the body. Okay, this is because of hyperandrogenism, where androgen is more in your body, testosterone levels becomes high. In such cases, excessive growth of dark coarse hair happen on face, chest, lower abdomen, inner thighs, back. Deepening of voice will happen, hair fall will happen, decreased breast size will happen. So some remedies are specific, like I'll tell you, thyroidinum is one remedy. Psychoco, it's a bowel no soap. Okay, oleum jack is one remedy which will decrease the hair for sure. So what a lot of homeopaths have this question, and even patients will ask you what it will do. Will it remove my hair? So just tell them it won't remove your hair, but it will decrease the growth. So, once your testosterone levels comes normal, once the growth is less, then you can go for hair removal treatment later. But if you keep removing the hair every month or every 15 days, what will happen? It will grow again. So don't go for that until your hormones are at normal level. So that's why these remedies help. So all the psychotic remedies comes into this. Tuja, meadow, calcarea carb. Okay. Now I will be telling you one case, and then we will invite our guest speaker, Dr. Malak. So let's look at this case quickly, and then we will ask sir to come here and share what he wants to share. So this case visited to me. She was a 46 years old female with endometrial hypoplasia with polyp like endometriosis, and it was a very bad case of bleeding, prolonged bleeding. She was fainting badly because she did not have hemoglobin at all. It was a almost, she just told me, she came and she said, doctor, it is as if the tap is open. It's bleeding that badly. So she said, recently this happened that 4 times I felt my BP is low. And then my daughter said, no, mama, it's because of your bleeding. So the last menstrual period happened on 11th January. And then before that, 6-7 November. And from 11th January to 2nd Feb, imagine for 22 days, the bleeding was going on in the same way. She said, doctor, now it's not too much of bleeding. I have to use 4-5 pads in a day, but it's still profuse. So in between, it stopped for 2-3 days. It again came, and she said, generally my period lasts for 3 days, but from last 5-6 months, this is happening. 20 days, 30 days, sometimes 35 days also happened. She said last month skip hua, and then again it came. There were clots, there was pain. She said, I'm a little tensed about my home because her classes were closed and all those things. And she said, at night I feel frightened, ajeeb sa dar lagta hai. She had problems with the mother-in-law, the typical mother-in-law, daughter-in-law thing. And she said, my brother-in-law went to somewhere else, and because of him, the husband's and her relationship is affected. So she said, everyone interferes in our house, everyone interferes between me and my husband. And she had a coaching business, she was very focused about work. She said, this, since I got married, my mother-in-law always had a problem. It's a typical case, and she had phobia of going downstairs. She was very weak, obviously, because she was losing lots of blood, and she has strong desire for salt and potatoes and burger and hot dog and bread. She said, bread I love. I can eat sandwiches and anything with bread. So bread is must. So what was the totality for? So first thing which I wanted to treat in this case was this bleeding, because it was so bad, and I could look at her. She was totally pale. So she said, bleeding is extremely profuse, making a patient weak and faint, weakness triple plus, and bleeding protracted. So I just took this much part, okay, this much into repertory. And I did not think about other things. I just gave trillium pendulum. Can you see the first remedy is trillium pendulum? And why I gave, I'll tell you. Because trillium pendulum is known for this protracted bleeding. This is a known female remedy for profuse menorrhagia. So I gave 1 dose tele for 1 week, and I also gave SOS 1 dram. I said, you take whenever you feel that you are very weak or bleeding is too much. So the she came to me in Feb. So this is in March 22. 20th March, she said, I took your medicine and I was okay. 13th Feb, the bleeding lasted for 8 to 10 days and not more than that. Bleeding was profuse on first day, but now it was okay. And her weight was increasing. That was such a relief for me. No fainting this month. Weakness is there, not like it was before, because still she was, gaining all the nutrition. So this time period was much better. bleeding happened for 8-10 days, not, but it was not for 20 days, 25 days. Then in follow-up, she said, my hair fall is very severe in between, but now it stopped. So after Trillium, her hair fall also stopped. Sleeplessness was there. She was little stressed because the mother-in-law was living with the Devar, with the brother-in-law. She came again. So she said, I'm little stressed about the family situation. And then she spoke about her headache and backache. So this time what happened, because the bleeding was relieved and she was better, her weight was increased. So I could then focus on her general and mental characteristics. But in the first visit, I did not give her other remedy. I wanted to give something for this bleeding only. So now I considered patient symptom. I took everything: perspiration, profuse, bread desires, potato desires, because that was so specific. And fourth row came very prominent. So fourth row issues related work-life balance and security was an issue to her. Family problems were there. And, she had this mineral theme that, oh, I'm losing this, I'm lacking this. So when I took this, and can you see Calcarea came very strongly. Calcarea actually. So I gave Calcarea Carb LM1 daily for a month because it was again a hormonal problem. She had endometrial hyperplasia. Okay, and doctors have suggested her for hysterectomy because she is 46. So the gynecologist said, now why do you want your uterus? It's totally, not needed. Just remove it because we can't read this polyp. So Calcarea Carb LM1 for a month. After 3 months, periods are regular, much better flow. Still the bleeding is for 8 to 10 days, but 60% less than before. She told me. She said, earlier I was changing pads 4-5 times and I thought it's normal. But now I'm changing pads only 2 times a day for 3 days, and then 1 pad is sufficient for whole day. So the bleeding was, became spotting, and her sleep was better, her appetite, her overall general energy was much better. And in August, again bleeding happened. So she was better, everything was going normal, but in August what happened, again the same thing happened. She again fainted, and then gynec again said, aapko bola tha surgery kara lo. So again I gave Trillium pendulum for 3 days plus iron syrup and iron rich food. It stopped within 7 days after the remedy. 7 days, it took 7 days. Okay, no magic, but still she was much better. And then in 6th January, almost after 6 months, no endometriosis, no polyp, no complaints, periods regular and totally regular. It is coming in every 28th day. And look at this USG. See, this was from February 21, endometrial hyperplasia with polyp. Can you see? It was quite big, 15 mm or something. And this is 6th January 2022. See, anteverted uterus, everything normal ovaries, no thickness. So this is what happens when you treat the case with therapeutic remedies, with organ-specific remedies, along with constitutional remedies if required. So these type of cases requires flexible approach because it has 2 states, one which is local pathology and other which is general symptom that is part of the patient. And in such cases, we may require 2-3 remedies according to prominent state. And, you just prescribe that and that helps patient to get rid of the disease. So that is what I wanted to tell you. And now we have with us, I just stop for some time and then again I'll rejoin. So we have with us Dr. Malak Shah. Dr. Malak sir, can I'm not able to see you. Okay. Are you there? So Dr. Malak Shah is from Gujarat. He's practicing from 2007. He is also an associate professor in college. He has done his MD. He has also done FHPC, which is fellowship in psychiatry, and he has special interest in psychiatric diseases. He will be sharing, his experiences with treating psychiatric diseases in our psychiatry module. And I just want to call him. but I'm not able to see him actually. Yes, I got you. Can you please start your video? Sir, we can't hear you. You're not audible.
Hello.
Yes, sir. Just a second. Yes, good evening.
Hello, hello. Very, very good evening.
You're most welcome, and thank you so much for joining this session. So Dr. Malak Shah is a senior homeopath. He's an amazing homeopath with a lot of, very good success in clinical practice. He teaches very well. He has an institute called Dynamis, and his clinic's name is also Dynamis. Sir, welcome and kindly share. You can share the screen. I've done the settings.
Sure. Thank you. Thank you, Dr. Yamini. So, am I able to share the screen?
Yes, yes. Your screen is, we can see you and screen.
Just a minute. Hello. Hello.
Yes, yes, sir.
Are you able to see the PPT?
Yes, yes.
Okay, okay. So, very, very good evening to all of you. And when I had some discussion regarding this therapeutic masterclass with Dr. Yamini, I was thinking, and she told me the topic, you need to take this particular topic, psychiatric disorder. So the first thing which came at that time in my mind, that how it would be possible to have specifics for different psychiatric disorders, like for, because what I understand therapeutic means we should have some I can say shortcuts regarding the given pathology. It's not exactly the shortcuts, but we will have a kind of bunch of medicines from which we need to select for that particular pathology. So at that time I was just thinking, is it possible, and how we can proceed further? Because look, in I can say regarding the body, regarding the various systems of the body, I can say for the CVS or the RSP, all have their specific organs, and we all have specific remedies for that organ affinity. So therapeutics in that way would be possible, but how we can go further in psychiatric cases? And that is again a kind of a specifics therapeutics. So when I tried to understand how we can deal with, or can we have a such kind of therapeutics in psychiatric disorder? So what I believe, yes, is it possible up to certain extent? And but for that thing, as we need to understand applied anatomy and physiology in the pathological disorders, by the same way here we need to understand the psychodynamics of various psychiatric disorders. So what actually these psychodynamics is? First we need to understand this part. Okay, what psychodynamics means? What is psychodynamics of mind basically? So if psychology point of view, if we try to understand this part, we have mainly three parts. We can have a three part of our mind. We can divide basically. One is id, second is ego, and the third is superego. Now what is id? Id is the actual what we are, our basic course, our basic core, the original we are. I can say where I can say no any outer layers. The original we are. That is what we consider as id, id. The second is a kind of a super ego. So here I can say this heart is to be considered as a id, and this brain thing is to be considered as a super ego. So it's like the what our brain says, that means rules and regulation, and the outside reality, that also we need to balance with our id. And this balance will be done by these middlemen to call ego. So it is like the same way, like one side id is there, second side super ego is there, and this poor ego has to balance the both one. Id says, I want this thing, I need this thing, satisfied me. For example, if I say a craving for, I can say some delicious food, wants to eat more and more, super ego says no, stop, just think more about having a balanced diet, just have a proper food at proper time. All these delicious food should not allow at a time. So the poor ego need to have this balance between these two things. And this ego is in a kind of constant pressure to keep this balance. So until and unless this ego is a kind of be able to handle the both the part id and super ego in a balanced form, will be a kind of a happy person, or I can say healthy person. Sometimes of course at the subconscious level or at the unconscious level, the id part would be able to display oneself in sense of dreams. For example, dreams of missing drain, or some dreams of having some fear, or some animal is behind, or fear of ghost or examinations, which even happen even at the age of 70. So that is what is suggesting our id part, our fears, our anxieties, our inner thing. So that is what one side id is there, another side super ego is there. So until all this is in a balanced form, we are completely healthy in a mental level, at the psychiatric level. But what happens when a pressure is so much sometimes on ego? There is a constant pressure either from the id side or from the super ego side, and sometimes that pressure is so much so there and so much constant is there, it tend to weaken our ego. Hello, are you able to understand, all of you? Am I fast or my speed is okay? Hello.
Perfectly okay, sir.
Okay, I need some feedback.
Yes, definitely. We are here.
Okay. So when this ego is weak, it tends to produce a kind of a disorder in, I can say, in the psychiatric, there are various psychiatric disorders, I can say. The first one, which and the commonest one, is the anxiety disorder. And again, in anxiety disorder, I can say there are further divisions are there. Regarding that, we will talk later on next time, mostly. And the second thing, when there is an ego and super ego, it tends to produce severe stress on the ego. And when that ego is at the verge of breaking, not still break, but at the verge of break, so that constant pressure from both the side, when this happens for the longer time, it tends to produce another kind of psychiatric disorders, to which we termed OCD, obsessive compulsive disorder. And here we find an effort of ego to regain control over situation. Okay, so the next, when the pressure is so much so from outside. Outside, that means either from the ego side, or either from the id side, or from the super ego side. Finally, ego breaks down, and when this ego breaks down, we would not be able to or to see the reality as it is, and it tends to produce illusion, delusion, and hallucinations. To we termed as a, it's a kind of wrong perception of reality. Not sometimes, but it is a constant state of that psychotic or the schizophrenic patient, where we find there is a total ego breakdown happens. So here what happened, there would not be any filter between inside and outside. There would not be any filter between id and superego, and which tends to uh, I can say this produce a state of that particular person that it would be, I can say, nearly impossible for that person to live one's life in a healthier way, I can say, in the society. Not possible. For example, if I say, okay, some person who has having a very strong delusion, which is a constant, that delusion that he or we as having a fear of giving poison, how would be a state of that particular person? He would not be, or she would not be able to trust on anyone, even one's own father, mother, or brother, sister, or wife, to the anyone, I can say. He was will be a kind of constantly in a state of a mistrustfulness, so which creates a kind of a impossible thing to have a routine regular life. So this is a kind of a state of a schizophrenic person, I can say. So this is what I am tell you, what I want to convey to you is, these are the, I can say, the psychodynamics of our ego, which tends to produce a kind of a state. So based on this condition of ego in a given case, we can presume that what kind of psychiatric disorder is going to happen to that particular patient or particular person. And by the same way, even for the, I can say, the various homeopathic medicines, when we try to understand the psychodynamic aspects of various medicine, based on the similibus currenter, our basic homeopathic principle, we would be able to give the right medicine for that particular patient. And I can say this is the way through which we can have a certain group of remedies for that particular psychiatric disorder, to which I can term as a kind of a therapeutic for that particular disorder. Like I can say the various examples or various disorders like psychiatric disorders or OCD, or I can say some specific phobia, or for the schizophrenia, or for the depression. So we can make a kind of a various therapeutic group of the medicine for all these various types of disorders. So let's try to understand this thing with a case example. So just I have summarized the case. I have not given here the full case. So this person, I can say 33 years male, a married person, who came to me for his complaint of generalized anxiety disorder and depression up to certain extent. And when I asked him, okay, right now, what thing is bothering you most? Why you become so much so anxious? What actually the problem is? So at that time, he told me, my problem is this fluctons. Now, what is flucton? I am also a kind of try to understand what actually the flucton is. So what he sees basically, sometimes even we all see when we close our eyes and open our eyes, some semi-transparent, a kind of a design like a thread, which will going from above to down. Yeah, from it's a kind of a moving semi-transparent thread-like structure happens against our eyes in our vision, to which we termed as a eye floaters. Are you able to understand what flucton is?
Yes, sir.
Yes. Okay.
Yes.
Okay. So these are the spots in the eyes, which I can say we are having a kind of some string-like structure or a cobweb-like of structure, which move in our eye in that whole, I can say, in our vision. So it is totally normal, huh? It's not an abnormal thing. Uh, I can say we all have seen such kind of floaters in general in routine life. But the problem is, in this particular case with this particular patient, when he sees this particular thing, he just asks himself, is it normal or abnormal? Should I see this thing or not? When he consult some ophthalmo, he tell, okay, it's totally okay, not an issue. It may be related with some of age related changes would be there, but don't worry, nothing happens with these flictons, so don't worry. But he was so much so sensitive because of these strings, these cobwebs which appear on his eyes on that particular plane. He becomes so much so, he feels like that guy. I
I'm
feel
so
very
sorry
much shocked.
to disturb you, but your slides are not moving.
Uh-huh.
Yeah.
Now,
No,
now,
no. You just stop sharing and start sharing again. It might help.
possible.
Yes. Yes, it is visible. Thank you.
Okay. So when I asked him regarding this problem, tell me more about these things. He told me, I feel really, he was really in a shock, huh? Literally. I remember his face. He was literally in a shock. Okay, what could happen if this doesn't stop here? The fluctons, the floaters he sees, uh, if it doesn't stop here, what could happen with him? And if something will happen with him, like a kind of a some big problem like a cancer or something, and even doctor has suggested, okay, if this happens continue for a longer time, we can give you a kind of a laser treatment just to satisfy him. But that is what is on his mind constantly, okay, what happen if this doesn't stop, my problem doesn't stop? What happen if I cannot see the clearly? What happens if this problem persists for a longer time? So there is a fear of operation and anxiety about oneself, and and this problem continues for a longer time, for last 9 to 10 months. So and so that's why for a longer period he was in a constant state of anxiety, ultimately which leads to produce a kind of depression in him. He cannot sleep, he cannot concentrate in job, he has having a continued fear of having cancer. What happen if some cancer happens? And because of this thing he has started to lose weight because of this anxiety and depression and all the thing. And he also thinking so much so, okay, why all these thing is happening with me? And there was a constant stress that I am the only son, then who will take care of my parents and my family? And if anything happens to my eyes, I become totally dependent on them, specifically to do the routine things. And when I ask him what will be the worst thing, the worst for him is becoming blind. So very frankly, it is not even possible, okay, with this problem of floaters anyone can become blind. But that is what he's so much so exaggerated anticipation and the anxiety thing. Then they are not capable financially. He was talking regarding the parents, they are not capable financially. And if I am also not capable, how will they handle? I am the only earning member. Even society also will not help us, no one help us. Then how will my family will survive without me? So that is what is constant. He was in a state of this anxiety. and followed by that the depression because of this Lipton's problem. Even in dreams, he has having a dreams of losing eyes, and he become a kind of a dependent. In dream, he just saw himself that he becomes I can say dependent on a family. What if I die? Then how my whole family will survive? That is what is also constant in his mind and even in his dreams. So when I asked him, then how do you feel? Then how you will handle this situation at that time? So he told me, I cannot do anything at that time. I just have to accept. What can one do? I have no any other options. So that is what the state is, I can say. Any suggestions from your side? So this is the, I can say, the crux of the case. If anyone wants to name the remedy. Yes.
Argentum nitricum.
Argentum nitricum. Okay. Why? Okay. Any other clue? Okay. So person may require Argentum nitricum as a medicine, not an issue. But here, what I have to basically understand, in this particular case, the basic issues are, I can say, so much so anxiety. That is again very much in an exaggerated form anxiety regarding one's health. Look, as I told you, we all have these floaters. We all have seen these floaters, I can say, but no one would be so much so anxious regarding that part. So that is what the thing is, which we really need to treat basically. So here, the family is totally dependent on me, and without me, they would not be able to survive, and they feel very helpless. These three are feeling of very helplessness, anxiety, anticipation in an exaggerated form, and the family is totally dependent on me. And without me, how they will be able to survive? These are the, I can say, the basic of the case, on the basis of which I need to select a medicine. And even ego-wise, if I try to understand, his ego is very big. Even slightest truffles like a floater, which is common, tends to produce so much so anxiety and stress in that particular person. So when I try to understand this thing, okay, how I proceed further in such kind of case. So basically, I need to select such medicine which has a weak ego as a base. So when I study all the three kingdom, and for this particular case, if I study the mineral kingdom, I can say the medicine belongs to column 1, and that is again, as person has told us, he has having a problem to regarding to having a routine life, who will be a kind of uh, the family is totally financially dependent on me, and they would not be able to survive for specifically regarding financial things. And to do the routines, I have selected the row 4 and column 1, which has, I can say, the biggest ego amongst the all column. I can say when I combine these both things, row 4 and column 1, the element which came is Kali, and along with the Kali, the another element which I find here is very characteristic is carbon. That it's a kind of person would not be able to tell us what happened if he's no more, and totally when the people and then the family is totally dependent on him, and when he's no more, how would be, how will they handle the further things? He would not be able to tell us the answer. So it's a kind of lack of total reaction is there. So when I combine these two things, Kali and Kab, the finally medicine which we should give in this particular case is Kali Kab, which already I have given, and I have given 1 m dose every month, and I have at least 8 to 10 years follow up. In between, of course, when he is totally okay, I have stopped the medication again. So this is the case of, I can say, 2012-13. He was completely okay after 6 or 8 months. Again in 2021, during this corona phase, he came again, and with the same medicine, Kalikab, for the other issues, not for, of course, for the fluctons, but other issues are there, but which are again related with his psychology only, appears, and with the same medicine has given again a good result in the same person. So I can say Kalikab has done its work in this particular case. So follow-up is very well. So this is the follow-up, I can say, after giving Kalikab, after, I can say, 6 to 8 months after giving Kalikab, he was completely okay, and finally at that time we have stopped that his treatment, and then again he just came back after 8 to 10 years. So what I really convey to you here, yes, so in anxiety disorder we need to attend. So this is one of them. Kalikab is one of the remedy who has having a weak ego. So we need to understand what are those other medicines in our homeopathic materia medica which has a kind of weak ego, and we can make kind of a group of medicine which we can use for various types of anxiety disorders. And that is what we can do, and we will do in this our master class of therapeutics, and in a psychotic disorder sessions related with psychotic disorders. So this is what is from my side, and look, I have given you a very gist of the things, the thing or the medicine which you already know, but the, I can say, the newer aspect is to understand the remedy, all those medicines which has a such kind of big ego, which we will discuss all kind of, we will discuss all kind of these remedies in our master class therapeutics. So any questions till now? Any other thing you want to ask? Hello? Hello?
Yes, sir.
Yes. So this is it from my side. Any other question?
Yes, I can see one question in the chat box. Dr. Reena is asking, can we take hypochondriac for this case?
Yes, we can, absolutely. We can take. Kalikab is very hypochondriac medicine, of course. So
yes.
will be
Someone also written anxiety for family, so that is true. Of course, he is anxious for the family.
Yes.
Yes. Guys, you can write down questions if you have.
So yes, I can say arsenic and argentinum nitricum are a kind of a very anxious remedy, not an issue. But if I try to understand this both remedy, arsenic and argentinum nitricum, Dr. Gulmeet has typed this thing. I can say in both the case, the ego is not that much weak, which tends to produce a such kind of severe anxiety disorders. So that is what is helping me, really helping me. Okay, there are certain kind of remedies which has a capacity to produce certain kind of psychotic disorders. Argentinum nitricum and arsenic both will produce more pathological problems compared to the psychiatric disorders. So of course we can give arsenic and argentinum nitricum where there is a pathology related with arsenic and argentinum nitricum. So strong pathological side also will be there in both of these remedy, I can say. So they are not having so much so weak ego, I can say. which tends to produce only a psychiatric disorders. Some pathological connections or some pathological, I can say, the support, the side also will be there in both the remedies, arsenic and arsenicum nitricum, I can say. So
Yes.
that's why it is very important to understand this, how the ego is developed in that particular person when you are dealing with psychiatric disorders. So that is what is my learning, I can say.
Yes, that would be great learning for us as well, that we need to understand. That's why we have, we have called sir, because he will be sharing a lot of basic things, how you should tackle psychiatric cases. Because all of us, every homeopath, I'm telling you, gets psychiatric cases. It could be OCD, it could be phobia, it could be anxiety disorder, depression, mild form, severe form, whatever. And we all feel that it's an area where we can do a lot. We can bring a really positive change. So if we understand few things, few basic things, I guess we would be able to help people in a better way.
Sure.
Sir, there are two questions. Dr. Reena is asking how to reduce allopathic dose. This is a constant question in all in our minds, that how to get rid of allopathic dose on psychiatric patients.
What I am doing in general, when when a person who is coming with me who also is continuously taking psychiatric medicine along with, and now he wants to start homeopathic, I will say it's up to your psychiatric doctor. Let him decide, let your doctor decide. So when your conditions, when your severity of the symptoms and intensity will be less, automatically their psychiatric doctor only will reduce the dose and keep it on a minimum dose. So I can say better not to reduce by oneself, by yourself, because it tend to produce I can say many blunders. That is what I have seen. Even though if your medicine is right, and at the same time, if you stop the all allopathic medicine, it tends to produce severe reaction from the patient side. So better to not to handle unless and until you have a detailed depth knowledge regarding the allopathic psychiatric medicines, I can say. And even if you want to reduce, it should be in a very step-by-step process, in a tapering doses. And that is also, you need to understand which one to taper first, which one to taper second. So it really requires, I can say, I can say pharmacy related knowledge of that particular psychiatric drugs. That is what is crucial, I can say.
Yes, very true. Tapering is required, and we can't decide the doses because we are not expert of that. So let the psychiatrist decide that. And I feel the similar in a similar fashion you can do for endocrinal problems as well, hormonal problems. So whenever you are treating thyroid patients, PCOS patients, or diabetes patients as well, because a lot of times this happens that the sugar goes down. And even if this patient if he is taking insulin or some hypoglycemics or anything like that, and your medicine, and if he's getting better, the doctor, the endocrinologist will surely taper down his own medicine, because they know that if they keep giving it, that will create problem. And if you do that, the major side effect is that you will see withdrawal. So this withdrawal syndrome is another problem to handle. So we should not do that by ourselves.
I can say, when you start the medicine, don't be in a hurry to reduce allopathic medicine.
Very true.
It will happen step by step. Just let your medicine work first, and then after, step by step, you can reduce the dosage.
Yes. One more question, sir. So Dr. Shraddha is asking, psychodynamic of pimple is small outburst of anger. So can we consider like this?
I'm not able to understand this.
I also didn't get the question.
I can say psychodynamic has nothing to do with the pathology. Either it is pimple or a sneezing or a headache or a heart problem or a respiratory problem. Psychodynamic has to do with your mind, how your mind will be able to handle your life. That is what is psychodynamic is related with. So it has, as I told you earlier, it has mainly three things: id, ego, and superego. When all these three are in a balanced form, we will be remain healthy mentally. And when there is a disturbance, and when the ego would not be able to handle id and superego at the same time, it tend to produce various psychiatric disorders. So it has nothing to do with any physiology, or I can say any physical symptoms or any pathology, I can say. It has to do with your mind, how your mind handles the situations. So psychodynamics of people, if you are asking, I can say it will be totally depend on your that particular person. For example, I had one particular patient who told me she has a complaint of cancer for which she is coming to me. But she told me, I have nothing, I can say I have no tension and I have least tension regarding my cancer. But please help me for this particular pimple and acne, because it shows out my cancer. No one can see my cancer, but all one can see these pimples. So please help me to reduce my acne. So look, based on, not based on the pathology, but based on the mind state, we'll be able to go further.
Okay, so thank you so much for this beautiful presentation and for your clinical insights. We are really looking forward for this therapeutic session on psychiatry. And
Thanks. Yeah.
yes, thank you so much for joining. I know you were traveling and a lot of things were happening around you, but still you joined. You took this precious time out, and I'm really, really excited for this session.
Thanks, and it's my pleasure to share my experience. I can say we all can share our own experience and can learn together. That is what the main aim is, basically.
Yes, definitely. Thank you so much, sir. Thanks for connecting. And just I will take 5 minutes of all of you, and then we will finish this masterclass of therapeutics. I hope you have enjoyed the session. And I just want to tell you that we have other collaborators also, other speakers, just like Dr. Malak, who are genuine clinicians who have good experience of years together. Some young people are also there who have good experience of their topics. So we have kept 12 precious topics about which we are going to talk in this therapeutics course. So this course is starting from 29th. Earlier we wanted to start this course from 20. Schedule changes, and because one of our speakers couldn't make it on 22, we are just shifting this just a 1 week later. So this will start now from 29th of April, 29th and 30th of April, Friday, Saturday. So I just want to tell you a few things that how it is going to happen so that you understand this. Just a minute. Okay, so we were talking about female hormonal disorders. So there are many remedies, but there are some Indian remedies which you should always think about, like ficus religiosa. It's for morning flatulence, for bright red hemorrhage with constipation. There is this remedy Manispermum canadens. It's Dr. Sarkar calls it menstrual regulator. For patients who have bleeding disorders with vertigo, very good remedy. Ashoka, Jonosia ashoka. This is also a menstrual regulator, but you can prescribe this remedy in mother tinctures or low potency 3C, 6C, very good remedy for PCOD, for scanty flow. So you should always look for causation if you're treating a hormonal disorder or female case. And this could be psychological, like Dr. Malak said, you have to understand the psychodynamics. So this doesn't apply to psychiatric cases only. This applies to everywhere, because mind and body have strong, interconnections, which will give you a lot of symptoms. Then you should look for menstrual discharge, character, quantity, aggravation, amelioration, duration, before, after, and concomitants. These are very important things. And when you are treating PCOD cases, amenorrhea cases, if it is primary amenorrhea, look for psychosomatic things. If it is secondary amenorrhea, look for pregnancy, delivery, relationship with kid, and psychological symptoms around that. And never, ever forget to explore the hormonal function. This will give you very vital idea about what is happening inside. So this is what I wanted to share, and let's talk about the course now. So this will start from 29th April, not 22nd, which is written in this specific flyer, because it was made earlier. That's why, and I was in hurry, so I took it. So each, I want to tell you this. A lot of questions were there around this workshops. So what we are going to do, we will dedicate 2 days for one topic, and these are the topics. On the left side you can see 12 workshop topics. So one topic is thyroid disorder, so we are going to talk about hypothyroidism, hyperthyroidism, goiter, all the general clinical conditions which comes to you, not all disorders but major disorders. And then we will teach you remedies which are required to treat these type of disorders in general. And after learning these remedies, I can assure you, you can solve more than half of your cases, because these are the remedies which are commonly prescribed or commonly come for thyroid disorders. Then we have a workshop on PCOS, infertility, and female disorders. This will be a topic where we will have 2 speakers who will talk about cases, remedies, investigation, diagnostic part, and lot more. Then we have gastric and hepatic disorders, where we will talk about IBD, IBS, GERD, and constipation, and all those things. Then we have a topic, these days you will get a lot of people with nasal polyps, DNS, allergies, and a lot of upper respiratory tract infections. So we have 2 days for this topic. Similarly, for acutes, we will have Dr. Sunita Gandhi, who will be sharing her insights about how to treat acutes. Then for rheumatic troubles, we will have Dr. Jyoti. She will talk about arthritis, rheumatism, other joint problems. Then for migraine and vertigo, we will have Dr. Jaya Deshpande from Delhi. She is also a superb clinician who have beautiful cases and beautiful knowledge about how to use different remedies. Then we have renal disorders module, in which we will talk about renal calculi, CKD, strictures, UTIs, and all those things. For psychiatry, we have Dr. Malak Shah, who's treating psychiatric elements principally. He has done his major in psychiatry, and he will share a lot of insights about anxiety disorders in general. Then for respiratory diseases, asthma, bronchitis, cough, a clinician will come and he will share his remedies and his experiences with respiratory diseases. Then for children diseases, we have kept one module, and for skin diseases also we have invited a clinician who is very good in treating skin diseases. So these are 12 different modules. Each module will happen for 2 days, Friday, Saturdays, back to back. There will be different speakers, and at the end of each module, each day, we will solve all your queries. And you can also discuss your cases. We will do a special workshop after finishing this whole thing, and where you can send your cases, share your cases, and we will talk about your problems and challenges in clinical practice. So this is the Therapeutics clinical course for homeopaths, which we have designed very carefully after talking to many homeopaths who have given their suggestions, and we have also invited beautiful speakers who have immense knowledge and experience of treating all these diseases. So we have these speakers, Dr. Sunita Gandhi with us, Dr. Jyoti Udupi from Chennai, Dr. Sunita is from Mumbai, Dr. Jaya is from Delhi, Dr. Faiza is from Mumbai, she is working with Dr. Malak Shah from Gujarat. I will be talking in all the modules about my experiences. So these are our speakers, and many more we will reveal slowly. One thing which I want to tell you is that this is going to start on 29th April. That is the last week of this month. But there are so many requests to us to increase the early bird offer, which expired just 2 days back, 2 or 3 days back. So for today, to all of you who have joined through YouTube, Facebook, or here also, and whoever wants to join this course, if you register today or tomorrow. Okay, only for 2 days. We are just giving you this special offer that if you register today, it will happen in early bird. You can register yourself in 4999 for all those 12 workshop, which is for 24 days, and you will get certificate, you will get recordings, and every module will be an exclusive workshop for that particular topic. You will get a lot of knowledge. And also I want to tell you that you can register for individual modules if you want. So we will release individual modules slowly. Okay, for each module you will see a flyer, and details will be there on all the social media channels of Asha Homeopathic Academy on Instagram, Homeopathy Junction on Facebook. So you can register for individual modules as well. But if you register for entire course, there are a lot of perks which you will get. Also, first 10 people who registers today or tomorrow will get 50% off on clinical diaries of a homeopath. This is an entire series of 10 months, which we did last year. And in that series also, we discussed about a lot of therapeutics, about different remedies. We have discussed about potency. There was a session on LM potency. There was a session on mother tincture. There was a session on, thyroid also was one topic. So you can get that series at 50% off if you register today or tomorrow only, not after that. So I invite all of you to get registered yourself and join us for this journey. We will definitely learn a lot from our speakers, from our participants, and we will have good time together in learning and sharing each other's knowledge. So thank you so much for your patient hearing. If you have any questions, you can ask me. You can just type in the chat box and I'll be more than happy to answer them. Or you can contact us on this email, ashahomeopathicacademy@gmail.com, or on this number. This is a WhatsApp number. You can just send a message and you will get all the details, or you can DM us on Instagram or Facebook also.
इसका है क्या आशा होम्योपैथी?
आशा होम्योपैथी.
Do you have any questions? Okay, so if you have any questions, queries further, if you want to register, kindly contact us on this number, email, or social media channels. Thank you so much. Have a great Sunday, remaining Sunday, and I hope you enjoyed this masterclass. Timings. So so I forgot to tell you, timings will be 7 to 9 p.m. for each module on 29th and 30th. 7 to 9 p.m. Dr. Guneet, and you will get the recording. So if you miss the session or anything happens like that, you can watch the recordings. You can use M and LM potency on daily basis. Yes, if it is required, you can LM for sure. Okay, because LM, the most important thing about LM and the benefit is you can repeat it as much as you want. Thank you so much. It was indeed my pleasure to share my insights.
Thank you, ma'am.
Thank you so much. Good night.